Hello, everyone. Thanks for joining. My name is Anna Beltran. I'm a nurse informaticist with the ORCHID team, and today we will be going over essential ORCHID documentation and workflows specific to inpatient nursing. And this specific topic today is iView and INO. Before we get started, if we can please place yourself on mute. Please do not put the call on hold. Hold all questions to the end of the presentation. And for everyone's information, the sessions are being recorded and will be made available shortly after the call. All right. So we're going to go ahead and log into ORCHID. Remember that depending on what role you are given to access ORCHID, that will determine which navigator bands you receive. So everything is tailored to, if you're working in a med-surg area, you will have those types of bands available for you to document. If you work in the ICU, you will see ICU bands, PEDS, etc. Okay, so when you first log into the patient's chart, you're going to go to the table of contents under menu. You're going to go to iView, INO. Okay, once you're here, if you look over to the right, you have all of these gray, what are known as navigator bands. So the first one typically is adult quick view for adult patients. Then you'll have your adult systems assessment. You'll have your adult lines and devices. You'll have your intake and output, blood product administration, adult education, advanced graphing, PCA, post-fall, so forth. Okay, so all of the basic bands that you would need for your bread and butter documentation on a daily basis will be defaulted open for your role. Okay, should you need any additional documentation, think of iView as your flow sheet, your nursing flow sheet for all of your documentation. If you see something you don't have here, let's say you have a patient, and I'll just use the example, that's going to the OR. I'm not seeing anything regarding a pre-op checklist. So I would go up to the top of my toolbar. I'm going to go to View. This is how you would add any navigator band that you might need. You're going to go to View, Layout, Navigator Bands. This will open up a list of all available navigator bands available within ORCHID. Okay, so you see everything from ICU to behavioral health to burn care. Everything available is here. Just for demonstration purposes, we're going to go ahead and add a pre-op checklist so just you can see how to add one of these bands should you need to. So you go ahead and select the navigator band that you would like to add, and you move it over with this arrow to the current document type list. Okay, now you can see that it moved over pre-op checklist. I'm going to go ahead and click OK. So it's telling me, I get a pop-up window that says you will not see this navigator band until you close your patient's chart and reopen. Be mindful that you don't have to actually log out of ORCHID and re-log in. Just go ahead and click OK. Close your patient's chart by hitting the little X here. It'll take you back to Care Compass, where your patient lists are. Click on your patient's name to enter that patient's chart. When you go back to iView and INO, we should now see our pre-op checklist navigator band there. Okay, so attached to the documents, we have the job aid also for this should you need to reference it, or if you need me to go over that at the end, I'll be more than happy to do so. So let's just go ahead and document within our adult quick view. Under our navigator bands, there are several sections to chart underneath. Okay, remember you don't have to chart every single item, but you'll chart what's pertinent to your patient. We're going to go ahead and make an example of charting for vital signs here. Right now I see my time column. Remember that when we chart all of our current charting, most current is on the left, and I'll show you that after we sign our documentation. So I'm going to go ahead and double click at the top. This will help me with navigating through the list a little faster. So we're just going to put in some vital signs, and I'll just get through some of these here. And what's nice is iView has some calculations that will pre-populate based on what you document there, and you can see that with the calculator symbol. So if you're not sure what formula they're using for that, you can hover over it and it'll show you the exact formula used to get that actual data. Okay, so you can see that there. Another thing you'll see within iView is something called conditional logic. Anytime you see this diamond with the arrow within it, if you go ahead and document RSPO2 of 98, it'll prompt you to answer further information. So where did you take that from? So we can just say the right hand. Okay? So it's nice that you have these features within iView. Once you're done documenting, you can see that all of what I've filled out is in purple. This doesn't mean that it's final or it's not documented yet. In order to do so, we need to come up to the left-hand side and sign by clicking on the green check mark. And that will actually turn our information black. Okay, so now you can see that my new most recent time column is over to the left should I need to document any of this information again. Okay, let's say I made a mistake and this heart rate was actually 70. I can click on that. Oh, excuse me, I could right click and I could modify that if I needed to. Okay, so I can put in 70 and then sign, and that'll document my 70, and that little triangle will show that I did make a modification. Okay, and that's okay. Sometimes we make a mistake with our documentation, and you can go ahead and adjust that accordingly. If you needed to add something, let's say I have these vital signs, but I only have temperature or oral or tympanic, but I'm actually doing an axillary temp. You could actually add more features by hovering here. You see Customize View. You can click on that, and that will display all available options under our vital signs. So I need temperature axillary. I would go ahead and check that off, and I hit OK. And now I can document an axillary temp here. And sign that off if I needed to. Okay, so that's a way to go ahead and do that. All right, so another thing I wanted to show under Adult Quick View is provider notification. So if we click here, usually anytime we communicate with the provider, let's say 1109, we'll go ahead and document here. I'm calling the provider because the lab called me on a critical lab. And I can state, whatever I want to document here. Which provider did I call? I can look up their name by clicking on the binoculars here. Select the provider's name. Did the provider give me any new orders? What time? All of that could be documented here. Okay? I would just sign that off. So those are just some examples of documenting within any of these bands here. Okay. So one thing I want to show you is under adult lines and devices. So most of our patients do have some sort of access. We'll go ahead and practice with a peripheral IV. If you see this little box here, is something called a dynamic group. So dynamic group is used when a patient could have multiple lines to that patient. So for instance, they could have an IV to the right upper extremity as well as the left upper extremity. You can see here I already previously documented that this patient does have a 20 gauge to the left upper arm, but let's say I just inserted a new one. So let's go ahead and click on Add a Dynamic Group. This will open up a box for me to create a label for the new line that I just started. So you go ahead and answer the questions appropriately. So I'm going to select over the needle. Now I placed it on the right upper arm. Scroll down a little bit more. Maybe I did a 22, and I would click OK. Now I have the option down here for the other IV. Okay, I'm going to double click to start documentation. So this is an insert new line, and I'm assessing the new line. So now everything that I need to document this new IV site would be here. So my dressing was dated, my insertion was successful, and so forth. I think you get the idea there. All right. So let's go ahead and talk about iView intake and output. So our next band is intake and output. Here at the top with this little folder, you have all of your intake sections. And then right below, you also have your output sections. Okay, so for intake, we'll go ahead and we see our little dynamic group box here. I'm going to go ahead and create one because my patient is drinking juice. I'm going to go ahead and add one for juice. And now I'll be able to document for my patient. Maybe my patient had some juice this hour. I'm going to go up to the green check and sign. Okay, my patient has a urinary catheter, so I could go ahead and document that this hour I removed 200. I would go up to the left, green check, and sign. And that'll start populating our balances at the bottom. Okay, and give the totals for the day as we go along. Okay, another thing I want to mention, I'm going to go ahead and open Adult Quick View again. There are several areas, different parts of the hospital where we associate devices to ORCHID. What that means is in the ICU, for instance, we would associate the bedside monitor, which is taking our patient's vital signs and measurements, to this patient's chart, so that when we document those vital signs, it would actually just pull over that information from the bedside monitor to our patient's chart, and we have the option to chart that way. If you're unable to associate device for whatever reason, you can still go within that section and document vital signs. It's not something that you can't do, but if you do have the option to associate a device, especially in the critical care areas, it will make your day a little bit easier. So in order to associate a device, you would come up here. You see this little associate device. Remember, if you don't know what anything means or what is this little icon, just hover to discover. It'll tell you exactly what it is. So associate device, looks like a little cell phone. I'm going to go ahead and click on that. Give it a second. It takes a little bit for it to load. And I won't be able to do it completely, but just so that you get an idea of what your screen would look like should you want to associate one of those devices. So some of those devices you could associate would be your vital signs, bedside monitors, your ventilators, CRRT devices. Okay, those are just some examples. So once this box opens up, it's your device association. It'll show your patient's name at the top. It'll say associated devices. There are currently no associated devices. What you would do at this point is you would scan at the bedside. There are scanners there with your ORCHID open. You would scan. Every device has a barcode label. So you would scan that barcode label. That would communicate to this pop-up window, and you would actually show that device populate down below. So the device name would show, and there's usually a number associated with it. Down here on the right-hand side, it's in gray right now, but it would turn, it would be in color, and it'll say associate. Once you have that device associated there, you click associate button, and now you would be able to pull in those vital signs from that machine. Okay. Similar to adding a device, you would also have the option to disassociate or remove that device once the patient is no longer using it. So if the CRT machine is being discontinued, they would want to disassociate the CRT device from this patient's chart. Okay? So I'll go ahead and close that for now. Let's see. I think that is most of everything. Do we have any questions or anything that anyone would like to see again? We do have plenty of time to go over anything you'd like to see again. Anybody? Okay. Going once, twice. All right. Okay. Any more questions? Alrighty, so we'll go ahead and end the call. We will make these recordings available shortly thereafter. If you have any questions in the meantime, please feel free to reach out. Okay, thank you so much for joining.